As you all know, that International Forum for Promoting Homeopathy was formed by a group of homeopathic lovers, students, and homeopathic doctors. And we have presentations from different part of the world. More than 65 countries participated. And we have 3 sessions in a row. The first session is already over, our Hindi session from 7 to 8, and 8 to 9, the international session in English is about to begin, and 9 to 10, we have local language session in Malayalam. Today, our guest is one of the person who is having a very good knowledge in cardiac diseases, treatment of cardiac diseases, and is known for that specialization. But today, Dr. NIRAV GANATRA, who has completed his MD and doing a PhD in homeopathy, and he's working as a in the Department of Organon of Medicine, Rajkot Homeopathic Medical College, Pearl University, Gujarat. And he is working as a resident medical officer, Sainath Homeopathic Hospital, Rajkot Homeopathic Medical College, Pearl University, Gujarat. And he has got some of the first awards. He has nominated for the Young Researcher Award, and he is the member of the review of in UGC approved journal, namely International Journal of Emerging Technologies and Innovative Research. He's a member of board reviewer in UGC approved journal, namely International Journal of Research and Analytical Reviews. And he has presented different papers in different publications. And one of the best thing is that he has presented a paper at World Irish Expo in 2019, and another the topic was a clinical open case study to explore the utility and effectiveness of homeopathy in cases of attention deficiency hyperactivity disorder. And he has an invitation from scientific research paper presentation at NIRAV Technological University, Singapore, and the topic of utility of homeopathic medicine in the case of depression. So that means that he has been presenting various papers in different parts of the world. And today, not only that, he has presented poster presentation for CCRH, clinical study papers on different subjects, lot around bronchial asthma. So many presentations, all those things were written in our brochure. So if you can go to the posters to find all those things, and he has done honorary speech in different places as a speaker in internal orientation program at the topic of scope of pursuing PG in homeopathy organized by SBL Pharmaceutical Association in Rajkot, and as a speaker in fire management training, got Red Hospital sign up and invited for key speaker in the seminar conducted on the topic when not to take medicine, organized by Vision School, Rajkot. So many people, such a brilliant personality is Dr. NIRAV GANATRA, and today, Doctor will be discussing one of the best presentation we can expect on scope of holistic homeopathy in management of hypertension, which is a common disorder nowadays. So let us invite our beloved guest, Dr. NIRAV. Welcome, Doctor. Please unmute.
For this brief introduction, and thank you once again for having me on this board once more for second time itself. This is the second time I'm going to give the webinar over this platform itself. So thank you, Dhanesh sir, thank you, Sahani sir, for giving this opportunity. And today's my topic is about the scope of holistic homeopathy in the management of hypertension. I'm going to speak about it. Is my screen visible?
Your screen is not shared, sir. Please go back and then again share. Reshare it. Yes, it is coming. Okay, okay. Table of content, introduction, like that. The first page is table of
Okay,
content.
now is it visible?
Okay. Scroll up. No, yes. Scope of holistic homeopathy in management of hypertension. That's the first page. Okay, fine.
Okay. So, scope of holistic homeopathy in the management of hypertension. This is going to be the topic. I have chosen this topic because just tomorrow itself, 17th of May, it is being celebrated as the World Hypertension Day. So, in accordance of that, on the celebration of that particular day, I have been chosen this topic, that the scope of holistic homeopathy in the management of hypertension. The whole presentation will be divided into the six aspects regarding the introduction and the epidemiological, we can say the aspect, or I can say the epidemiology of hypertension. Then we will be seeing the pathophysiology, etiology, and risk factors, and the symptomatic presentation also of the particular hypertension. Now, you would be knowing about it that more of the deaths really, due to the MI is being taking place in the age group of 20 to 40 at present, because of we can say we can say controversial aspects regarding the Covishield or vaccine related of the COVID, and other aspects also are there which is leading MI in the youth. So hypertension is being one of the major cause which would be discussing over here, that why hypertension in youth is increasing, what are the risk factors regarding the hypertension in the youth, and how we can control this in the youth. That also we'll be discussing it in a particular portion, that is hypertension in youth. Then we'll be seeing the homeopathic aspect, that what holistic homeopathy has to offer in the hypertension. We would be differentiating the miasmatic analysis, that how the hypertension is being evolved, and what are the miasms which are responsible, how the miasmatic development takes place in the particular aspect of the hypertension. That also we would be learning over here. And finally, we will be listing the few of the homeopathic remedies. In homeopathic remedies also, I have divided it to three parts, that on the first, on the basis of the, we can say, totality of the symptom, that is prescribing the individualized homeopathic medicine. Second, we would be seeing according to the keynote prescription, that how we are having 3 to 4 keynote symptoms, and then on the basis of it, we are going to prescribe the medicine. And at the last, a portion of homeopathic remedies which are on the basis of, we can say, the pathological aspect, what pathology is resulting into the hypertension, and then it is going to be a leading cause of death in the people. So how to prevent those with the help of pathological correlation, that will be seeing into the third aspect of those homeopathic remedies. So the whole presentation is divided into the six aspects. Let us move on. First, that is, according to the World Health Organization, what is hypertension? So, World Health Organization has defined it as, if a person is having systolic blood pressure more than or equals to 140 millimeter of Hg, and or a diastolic pressure more than 90 millimeter of Hg, then it is defined as the case of hypertension, and which is one of the most common chronic diseases nowadays. Every, we can say, 9 out of 10 people would be suffering from this kind of diseases. What is the epidemiology of the hypertension that is being described over here? An estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension. Most of the two-thirds is the case, we can see, living in low and middle income countries. Estimated 46% of adults with the hypertension are unaware that they have the condition. It is becoming like a silent killer, whatever, like it is, or we can say, which is not identified, asymptomatic in the cases, which cannot be identified with the help of some of the particular symptoms. An estimated 46% of adults with hypertension, diagnosed and treated, and approximately 1 in 5 adults, that is almost about 21% with hypertension, have it under control. Hypertension is major cause of premature death worldwide. One of the global targets for non-communicable diseases is to reduce the prevalence of hypertension by 33% between 2010 and 2030. So this is about the epidemiological aspect and the introduction regarding the hypertension. What we can come to know about from this epidemiology. From this prevalence, it is evident that hypertension is very important public health challenge because of the leading stresses, the various lifestyle disorders. The hypertension is the most vulnerable disease that is being attacked to the different age group of people, and because of its complications, including cardiovascular, cerebrovascular, and renal diseases, which are the major causes of morbidity and mortality. Reducing blood pressure in individuals with hypertension prevents or attenuates these complications. Hypertension is due to the specific causes in a small fraction of cases, but in the vast majority of individuals, around 90%, its etiology cannot be identified or determined that why hypertension is there in the particular individual. And in that cases, we can tell it as a essential hypertension. The term essential hypertension is being currently understood as a multifactorial disease arising from the combined action of many genetical, environmental, and behavioral factors. So, when a particular case of hypertension is not having any identified etiology, that comes under the classification of the essential hypertension. The classification which we are going to see again, according to the types of the blood pressures, ranges of the blood pressures. Given the multifactorial nature of blood pressure homeostasis, any change in blood pressure, as for example, one due to a mutation, is likely to be compensated by feedback. If a blood pressure is rising, our body is trying to maintain homeostasis into it. And in regards of that homeostasis, our body is going to compensate a feedback mechanism, which is complementary in action. Or we can say, which is trying to compensate that raised hypertension and trying to get it low. In some other control mechanisms in an effort to return the blood pressure to normal. It is only when the balance between the factors that tend to increase the blood pressure and those that try to normalize it is sufficiently disturbed, when the compensatory mechanism fail to counteract the perturbation, that essential hypertension results. If body has grown up to a particular type of a hypertension because of multifactorial aspects, we don't know the etiology, but multifactorial aspects have causes the rise in the blood pressure leading to hypertension, more specifically essential hypertension. There are the changes in our body which are trying to maintain that blood pressure and trying to control that hypertension, but they are failing, and this multifactorial aspect is winning. At that time, the essential hypertension is being resulting. So this is the just balancing the homeostasis inside our body. If the complementary, or we can say the compensatory action fails, and the mechanism which is causing the disease in the body is over dominating, at that time essential hypertension is taking place. This is the classification of the blood pressure, which is being given by the Joint National Committee in the 8th of its session, where it is being describing about the classification of the blood pressure according to the systolic blood pressure and according to the diastolic blood pressure. If it is less than 120 and less than 80, then it is in the normal category. If it is between 120 to 140 and 80 to 90, then it is pre-hypertensive stage. If it is more than 140 but less than 160, and if it is more than 90 and less than 100, then it is being termed into the stage 1 hypertension. But if it has passed the limit of more than 160 and more than 100, then it is stage 2 hypertension. So this is the classification that how normal, pre-hypertension, stage 1 hypertension, and stage 2 hypertension. according to the range of the blood pressure has been identified. So this was about the introduction and the classification regarding the hypertension. Now we will be seeing the etiology, risk factors, symptoms, and the pathophysiology. Main aspect is to know about the pathophysiology of the hypertension. If you would be knowing that how the disease is being spreading inside our body, then we would be knowing how to treat that particular disease. So etiology will answer that what is causing the hypertension, and pathophysiology will answer how the disease has been spread into our body. Etiology, it is the things that increase the risk of having high blood pressure includes older age, genetics, being overweight or obese, not being physically active, high salt diet, drinking too much alcohol. These are the etiological factors which are resulting into the hypertension, amongst which few of them are modifiable and few of them are unmodifiable or non-modifiable. That classification is being discussed over here. Modifiable risk factors include unhealthy diets like excessive salt consumption, a diet high in saturated fats and trans fats, low intake of fruits and vegetables. This all leads to particularly the essential hypertension in the youth itself. Now, this can be modified, so it is coming under the modifiable risk factors. Physical inactivity in our day-to-day lifestyle right now, we are not having any kind of physical activity. So lower physical activity or physical inactivity also leads to the stagnancy of the blood flow, and not active or not very much active blood flow in all our blood vessels. So physical activity or physical inactivity leads to the blood flow stagnancy, which is again going to lead to blood pressure. Consumption of tobacco and alcohol, being overweight or obese, these are the four risk factors, which can be modified and helps into the prevention of the hypertension. Some of them are the non-modifiable risk factors, which include the family history of hypertension, that is the genetical causes, or we can say the hereditary diseases, age over the 65 years, and coexisting diseases such as diabetes, or we can say the kidney disease. How kidney disease is causing the hypertension, that we are going to learn in this presentation itself into the part of pathophysiology. Lifestyle changes like eating a healthier diet, quitting tobacco, and being more active can help lower the blood pressure. These are the symptoms which is most commonly seen. It most of the time starts with the headache along with the dizziness, nausea, vomiting, vision impairment, heartache, undiagnosed or unanswerable chest pain. Here we can see the symptoms. Most people with the hypertension don't feel any symptoms. Very high blood pressures can cause headaches, blurred vision, chest pain, and other symptoms. When it is in the pre-hypertensive stage, or we can say to the stage 1 hypertension, people are not having such problematic symptoms, which can be causing some alarming sign inside the person regarding the hypertension. But when it is crossing its limits, when hypertension is trying to go shoot up, at that time these symptoms we can see: severe headaches, chest pain, dizziness, difficulty in breathing. Sometimes hypertensive effect can cause cardiomegaly, which is going to cause about the cor pulmonale. So when it is cor pulmonale like condition, at that time also the breathing aspect and the difficulty in breathing is also seen. Chest pain is also associated with hypertension because of the costochondritis and all. Dizziness, difficulty in breathing, nausea, vomiting, blurred vision, anxiety, confusion, buzzing in the ears, nosebleeds, abnormal heart rhythm. All these are the aspects which is leading to the particular hypertension, and cause it is being, we can say, symptomatically seen in the form of these symptoms. Now we are coming over to the pathophysiology aspect of the hypertension. I have divided this pathophysiology into three aspects: the role of sympathetic nervous system and sympathetic nervous system, parasympathetic nervous system. These two type of nervous systems are working in a complementary aspects, which are causing the control over the increasing blood pressure. If sympathetic nervous system is going to increase the heart rate, parasympathetic is going to decrease it. If sympathetic system is going to increase the breathing rate, parasympathetic is trying to decrease it. So complementary action is seen by sympathetic and parasympathetic nervous system, which are the part of autonomic nervous system, and they are responsible for maintenance of the blood pressure inside a particular human being. So if there is any problem in this autonomic nervous system's aspects functioning, that is sympathetic and parasympathetic, if they are being at a trouble, then at that time essential hypertension is being coming over the aspect. The specific causes of the increased sympathetic activity in essential hypertension are only partially known. Genetic influences are evident, and behavioral, that is as salty food preference, psychosocial, that is as mental stress, and lifestyle, that is a physical inactivity, factors appear to be involved. Of prime importance, no doubt, is obesity. The prevalence of hypertension in middle-aged obese subjects is 40 to 50%. Now, how the cycle begins? Because of the physical inactivity and we can say some of the mental stresses leading to obesity, increases the sympathetic, that is, including the renal sympathetic nervous system activity through the high sodium intake related mechanisms, which is again discussed over in the further slides, and through other mechanisms such as hyperleptinemia, hyperlipidemia, that will not be reviewed. Likewise, although the prevalence of hypertension increases with aging and 60% of all adults aged 60 to 69 years are hypertensive, owing to the pathogenetic factors associated with an increased sympathetic nervous system activity in the elderly, such as high dietary sodium intake and increasing obesity, and only the former will be discussed over here. On the other hand, clinical and epidemiological studies indicate that the importance of chronic mental stress is the utmost importance in the pathogenesis of essential hypertension. Even if we can see the kids of the age of 10 to 16 years are also having particular type of stresses in their life, which is leading to the development of the atherosclerotic change, which is again leading to the hypertension. So the chronic mental stress regarding any type of condition is leading to the growing hypertensive stage, that is the essential hypertension. So the importance of chronic mental stress and pathogenesis of essential hypertension is also of utmost care. Hypertensive subjects may decrease their blood pressure with a meditation program. Psychosocial stress can increase the activity of the sympathetic nervous system by potentiating the neural mechanisms activated by a high salt intake. So all these devils are causing the increase in the sympathetic nervous system. May it be obesity, may it be the chronic mental stress, or may it be the psychosocial stress. These all things are causing the increase in the activity of the sympathetic nervous system, which in turn potentiates the neural mechanism activated by a high salt intake. Race and ethnicity may also influence the predisposition to the sensitivity of the blood pressure to salt. Black Africans have a higher prevalence of hypertension and more frequent severe hypertension. They also have a greater blood pressure sensitivity to salt intake than do people of other ethnic origins. So race also plays an important role in the, we can say, the development of the hypertension. As we saw earlier also, the high physical inactivity also appears to be important. Aerobic fitness and physical activity are each inversely related to the development of the hypertension. Aerobic exercises, training in sedentary normotensive stages, and hypertensive people also reduces blood pressure and renal and muscle sympathetic nervous activity, which in turn helps us to lower down the aspect of hypertension. The second portion of the hypertension, pathophysiology of the hypertension, that is about the control of blood pressures by the kidney. If we know we have a RAS system in our body, which is controlling the hypertension stages in our body. That is, if the blood pressure is increasing, this RAS system, that is renin-angiotensin system, renin-angiotensin system, that is commonly called as the RAS system. This is causing the increase in the blood pressure and the decrease in the blood pressure due to the various aspects, and it is controlling the blood pressure in our body with the help of enzyme, that is renin and the angiotensin. These are complementary, acting towards each other and causing the control over the blood pressure. The relative stability of arterial blood pressure leads to the conclusion that it is a highly controlled variable. Arterial pressure is maintained at the level satisfactory to ensure an adequate tissue perfusion. Baroreflexes, that is the reflexes in the accordance of changes in the pressure, and vasoactive hormones, regarding which we talked right now, that is the renin and angiotensin, produce the tight regulation of relatively short time spans. Long-term regulation is most generally thought to be achieved through the renal fluid volume regulation mechanism. How in accordance to the blood volume and the renal regulation mechanism is being taking over to the blood pressure. If the blood fluid volume inside our body is being increasing, body fluid volume is increasing, then our kidneys will be trying to maintain it with the help of the process of diuresis. So if any change in this mechanism takes place, then also the blood pressure rises. Regulation of mean arterial pressure requires the integrated actions of the physiological systems affecting its most and major determinants. In the simplest formulation, it is being, we can say, this whole blood pressure regulated the mechanism is under the influence of the Ohm's law. Ohm's law in regarding the fluid dynamics, it is telling us about the pressure is equals to the flow multiplied by the resistance. How much flow is there inside of our body, how much body fluid is flowing inside of our body, and how much resistance that body fluid is facing during the flow determines the pressure. So two aspects, that is the flow, how much and in what manner. These regarding the flow, this aspect is regarding the flow and how that flow is being resisted. Now this flow can be resisted because of obesity also. This flow can be resisted because of the low physical activity also. This flow can be also, we can say, resisted due to the higher sodium intake, because the fluid is already low and it is having a resistance to flow itself. So higher sodium intake or higher salt intake leads to the lower body fluid aspect in the increased diuresis aspect. So it is going to reduce the flow and resist the flow. So ultimately causes to the increase in the blood pressure. So the basic idea regarding how the mean arterial pressure is to be regulated is being explained by the Ohm's law, which is being for the fluid dynamics, that is pressure is equals to flow into resistance. Blood flow depends on the cardiac output and the blood volume, whereas resistance is primarily determined as a total peripheral resistance by the contractile state of small arteries and arterioles throughout the body, which is determined by the tissues, blood flow, autoregulation mechanism. Blood volume depends on the extracellular fluid volume, that is ECFV, which itself is determined by the total body sodium content. The latter depends on the balance, that is the sodium equilibrium, between the sodium intake and the urinary sodium excretion, that is generally known as the natriuresis. That is the main root of body's sodium loss. Natriuresis is itself determined by the kidney perfusion pressure. Therefore, the application of the pressure natriuresis concept. For the purpose of following discussion, the term normal sodium intake refers to the current usual sodium intake. So if sodium intake is being controlled, natriuresis itself gets controlled. And if natriuresis is controlled, then the hypertension is being in our control. Blood pressure is being in our control. So this is giving us about the idea that how the sodium intake causes the disturbance in the blood pressure. Arterial pressure is set at the level required by the kidney to allow sodium and water excretion to match the intake. This is about point A. But kidney perfusion study shows that in the absence of change in perfusion pressure, sodium excretion exceeds intake. Excretion exceeds intake, or we can say the pressure natriuresis, which reduces the ECFV, that is the extracellular fluid volume, and cardiac output, and returns the map to the normal. So these are the aspect regarding the pathophysiology of the kidney. Now, if the disturbances are there, disturbances that tend to increase arterial pressure, such as increased peripheral vascular resistance, would cause only a transient increase in arterial pressure, because they would also provoke the increased renal sodium excretion. Conversely, if MAP falls below the control level, a reduced renal sodium excretion, that is anti-natriuresis, increases ECFV and MAP. The kidney strives to protect against the perturbance from the sodium equilibrium set point and sodium balance, and MAP are maintained by the feedback system, displaying infinite gain. Now, what is this infinite gain? That infinite gain is invoked to explain the fact that when sodium intake is increased, renal sodium excretion is similarly increased. In response to a very small increase, if any, mean arterial pressure increases to attain the sodium equilibrium. Now, what is the abnormal regulation of the kidney function, with the aspect of this MAP controlling, and the second aspect of taking the, we can say, first point of it, that is of the sympathetic and parasympathetic aspect. Both of these are being combined over here. The sympathetic nervous system exerts a basal excitatory activity over the kidney. Now, this increased sympathetic nervous system causes increase in renin secretion, which is going to cause elevated blood pressure. Second, increase in the renal tubular sodium reabsorption, which will cause the decreased natriuresis. And the third, renal vasoconstriction. Again, all these three multifactorial aspects is going to elevate our our blood pressure. Increased renin secretion, increased renal tubular sodium reabsorption, and the renal vasoconstriction. These three things are going to again increase our blood pressure. Experimental studies established the concept that the subvasoconstrictor levels of the renal sympathetic nerve activity can produce increased renin secretion and increased tubular sodium reabsorption. Sodium will be reabsorbed, so in the urine it is going to pass over less, and the body fluid would be leaking. Due to the leaking body fluid, again the hypertension is going to take place. Without changes in the renal blood flow and glomerulation rate, which results in the shift in the renal pressure natriuresis function to right, so that a higher than the normal arterial pressure is required to attain the sodium balance. There is now convincing evidence that the sympathetic nervous system activity is increased in patients with essential hypertension. So this was all about, we can say, the pathophysiology. Introduction and epidemiology we saw regarding what is hypertension. In the definition we itself saw that if it is more than 140 systolic and more than 90 diastolic, then it is going to be a hypertension according to the World Health Organization's guidelines and definitions. Then we saw about the risk factors and the etiological factors, modifiable risk factors and non-modifiable risk factors. And at last, we saw about the pathophysiology. Now we are going to see what is essential hypertension and how it is affecting the youth and how it can be controlled and prevented with the help of homeopathy. So essential hypertension in youth. Hypertension is common even in young adults itself. Now, this is the survey which has been done by the National Health Offices, that is NIRAV. This survey in 2011-12 puts the incidence of hypertension in the 18 to 39-year age group at about 7.3%. Now, obviously, it has been increased. There are no outcome studies of hypertension treatment in young adults, but short to medium term risks, 5 to 10 years of untreated mild and moderate hypertension, are likely to be low. However, long-term outcomes, that is from 30 to 40 years, are much more important people in their 20s than to those in their 60s and 70s, and it seems likely that hypertension from a young age, particularly if undiagnosed or untreated for a longer period of time, would carry a substantial long-term cardiovascular risk. Now, how to manage the hypertension? Strategies for mention, or we can say the strategies to balance this hypertensive patient. The objective of treatment is to reduce the morbidity and mortality from the cardiovascular diseases in hypertensive patients, which means maintaining the blood pressure values below 140 for systolic blood pressure and 90 for diastolic blood pressure, preventing, testing for, and treating the complication for hypertension. If young adults are having this hypertensive aspect, then we saw in the symptoms itself also that headache is going to be there. Then we can see about the dizziness is there, blurring of the vision is there. All these are going to give some or other type of a particular complication. So testing for those complications priorly or on beforehand would lead to decrease in the morbidity and mortality of the hypertension in the youth. This preventing can be done with the help of many other aspects, like preventing with the help of meditative pauses and all, increased physical activity, changing to the hygienic or we can say healthier food intake, determining and managing the risk factors that can be changed, which we talked right now about. That is the modifiable risk factors which we were talking about. Encouraging the compliance itself, that is, if we are giving a particular treatment to a particular youth for hypertension, then the compliance regarding the changes what he or she has been encountered during this aspect is also being important. So encouraging the compliance. Primary prevention of hypertension in the general population should be developed to complement this approach, as a reduction in the prevalence of the hypertension in this way would mean a reduction in the number of hypertensives requiring the treatment. In addition, people who are hypertensive would be more likely to comply with the lifestyle and the dietary measures if these measures were not very different from the lifestyle and food habits of the population as a whole. Now we are going to see about the homeopathic aspect of hypertension. What hypertension is playing a role in deranging the health of an individual, and how homeopathy is perceiving the hypertension, that we are going to focus about. Blood is a fluid connective tissue specially organized to perform the several functions in our body. The force needed to blood to perform its function is the blood pressure, and without that the blood will be not be able to perfuse. The combined action of the cardiac muscles and the muscles of the blood vessels work for this. Their action is under the control of autonomic nervous system and the hormones secreted by the endocrine glands, which is under the control of mind. See, we are going to the cycle. That is first to the, you can say, somatic aspect. That somatic aspect is controlled by, we can say, the endocrinal aspect, and that endocrinal aspect is again under the control of mind. So homeopathic medicines that act through this axis, which axis? That is the psycho, neuro, endocrino, immunological axis. Not only the hypertension, but we can see rheumatoid arthritis or many of the immunological diseases. These immunological diseases are due to the expression of autoimmune response or increased autoimmune response. This develops because of the psychoneuroendocrino-immunological axis. Any disturbance in this axis leads to the particular development of the disease. That is, disturbance in psychic disturbance causes neural disturbance. Again, that is disturbing to the endocrinological aspect and the immunological axis of the particular person. So hypertension is also a disease which is due to the disturbance in this particular axis. P and E axis, most of the time it is being found. So if any disturbance in psychoneuroendocrinological axis will again lead to the hypertension. Homeopathic system carries a good scope in managing the high blood pressure. Homeopathic medicines work particularly well for those who have recently been diagnosed, that is in the pre-hypertensive or the stage 1 hypertension, with hypertension and have not yet become dependent on any other medication for it. People with chronic high blood pressure and those who are using allopathic medicine, that is about, we can say, the stage 2 for a long time, can also be benefited with the help of use of homeopathic medicines. In homeopathy, health shows harmonious vital functions. Vital force and disease is considered as the alteration from state of health. Homeopathy treats the sick and not only his sickness. This is being mentioned in the Dr. Kent's writing in the lectures on the homeopathic philosophy. He quoted that Dr. Samuel Hahnemann once mentioned that there are no disease but the sick people. The first, we can say, the first chapter of the Kent's philosophical writings, that is the lectures on the Kent, in that it's the sick, that is the chapter's name. In that they have been, we can say, expressed about this aspect that there are no diseases but the sick people. And we can say the aphorisms fifth also, that is in the causes of the disease and the portrait of the disease also, we have been explained that we are not going to treat the disease in person, but we are going to treat the person in the disease. So that aspect is being also explained over here. So in case of primary hypertension, homeopathy is care with the patients having increased pressure of blood other than the hypertension oneself. So primary hypertension can be easily treated, and also the secondary hypertension that we are talking about, the stage 2, that can also be easily treated with the help of homeopathy. We are going to see about the miasmatic aspect. Now, what is the role of any of the miasmatic state, or how the miasmatic development causes hypertension, that we are going to see in this particular slide, that what is the main cause of the hypertension. Miasmatically, SORA is expressed as deficiency. So when we are talking about the low blood pressure, it is basically soric in origin. But hypertension is the expression of psychosis, because excess is the basic expression over here. If we see about the salt intake, excess. If we see about the fat deposition, obesity, excess. If we see about the physical activity, if we see into the negative aspect, it is excess inactivity, excess of physical inactivity, excess of salt intake. So all these excesses combinedly causes the hypertension. And this hypertension, due to this different multifactorial excesses, is coming under to the psychotic aspect. So hypertension is the expression of the psychosis, because excess is the basic expression over here. In psychosis, there is an incoordination in body function that we saw into the symptoms also, that is blurred vision, difficulty into the breathing. All these are the incoordination. These are all expressing the incoordination. Blood pressure is maintained due to the coordination between the several factors that constrict and relax the blood vessel. That we talked about the RAS system, renin-angiotensin system. And when that is higher blood pressure, renin is being decreased. When there is lower blood pressure, renin secretion is increased. So this RAS system coordinates into the controlling the blood pressure. Similarly, here also is being expressed that blood pressure is maintained due to the coordination between the several factors that constrict and relax the blood vessels. Here the coordination is lost and it becomes excess. More of it is being done. So excess of blood, we can say the incoordination leads to the psychosis and blood pressure. A psychotic person is narrow-minded. So when the same narrowness affects the blood vessel, this narrowness is being developed because of the excess deposition of the fats, excess body fluid volume, because of the decreased natriuresis, narrowing of the blood vessels. It leads to the hypertension. Mental aspect also is being explained over here. Okay, psychic origin, psychoneuroendocrinal aspect we saw. In that psychologically, if psychologically person is narrow-minded, that same narrow-mindedness is being described over the blood vessels itself. When the same narrowness affects the blood vessel, it leads to the hypertension. Here, the constriction from the mind goes to the vessel. That is from the psychological aspect to the somatic aspect, psychosomatic disturbance. Nowadays, we come across even the younger age groups having primary hypertension. They are the victims of the psychotic miasm. These miasms gets transmitted to the next generations, which we saw into the hereditary aspect or into the genetic aspect also. Nowadays, obesity is very common even in the children also. Metabolic syndrome is actually a blend of the excess in the different systems. So this leads to the psychotic development inside our body, and this leads to the development of the hypertension inside our body. Excess deposition of fat and hypertrophy of organs are also psychosis. The psychotic individuals become edematous due to the excess fluid collection and again leads to the hypertension. So development of hypertension is the psychotic aspect. But what about its complications? Leading to the atrophy of the blood vessels of the eye, which is causing the destruction of the blood vessels and the destruction in the vision. We can say the blurred vision, dizziness, anxiety, confusion. All these things becoming into the complications are coming into the syphilitic miasm, which we are going to discuss right now. When the cases gets complicated with syphilitic miasm, it leads to the destruction. Most of the secondary hypertension cases are syphilitic in origin. Development starts with the psychosis. Excesses are being developed. Now these excesses, when are getting a lot, it gets burst off. And this bursting off leads to the destruction. So this destruction leads to the secondary hypertension. Primary hypertension, multifactorial hypertension, we don't know about the etiological aspect and all. But when it is going to the secondary hypertension, to the secondary stages, it becomes syphilitic in origin. Tumors being developed. Now these tumors are causing the malignant hypertension. Malignant hypertension, infarction, cardiac failure, nephropathy, retinopathy, stroke, etc. are the expression of the syphilitic miasm. Hypertension due to congenital defect is also syphilitic. Nowadays, most of the cases are presented with the changeability in all aspects, including blood pressure, which is a blend of miasms called tubercular miasm. The journey started with the psychotic aspect, the multifactorial aspect, excesses of the multifactorial reasons leading to the essential hypertension. This essential hypertension progressed with the progression of the miasm from psychosis to syphilis, led to the malignant hypertension. At last, when all these blended, then came to the psychosyphilitic or sodic syphilitic aspect, that is our tubercular miasm. Now, this tubercular miasm, which oftenly is being due to the changeability, they often come with the hypertension followed by an episode of hypotension, which creates the confusion regarding the salt restriction and other medications also. Now, due to this hypertensive effect, it is going to create about the destruction into the capillaries, smaller capillaries, atherosclerotic changes, and hence involvement of blood and blood vessels is also a tubercular manifestation. So, miasmatic analysis on miasmatic aspect shows about how the journey started from the psychotic aspect, and if uncontrolled, if untreated, or if unmanaged with the help of proper medications, or we can say with the help of homeopathy also, if it is not being controlled or managed, then it is going to causes a very severe complications and leading to the tubercular manifestation. Homeopathic remedies for the management of hypertension, as I told earlier also, that I have divided this portion of homeopathic remedies into the three aspects. That is, I have divided in first in the aspect of, we can say, when we are giving it on the basis of particular totality, individualized homeopathic medicine is being delivered. Second, on the basis of the keynote prescription, 3 to 4 keynote if we are knowing, and then regarding it, we are prescribing the homeopathic remedy for hypertension. And at the last, that is the third aspect, on the basis of pathology. If any pathology is being developed inside our body and we are going to give the remedy, then it is coming under the third aspect, that is pathological prescription. Hypertension is the constitutional setup, that is, either it can be inherited or acquired, of an individual and the environmental factors, which can be internal also and which can be external also, that inclined a person to develop hypertension. Thus, the totality of different characteristic symptoms explained by patient and the specific sign leads the homeopath towards a similar remedy that remove the totality of symptom and also the symptoms of the high blood pressure. The homeopathic treatment of essential hypertension is based upon the principle of similia. Being a chronic disorder, it requires the constitutional anti-miasmatic treatment, and it is the totality of different characteristic symptoms that direct the homeopathy towards the similia. So, as mentioned, that homeopathic literature added by different stalwarts from the time to time, the following are the example of major ways of getting a choice of medicine in the case of essential hypertension. These are the major ways: prescription using the totality of the symptoms, keynote prescribing, and pathological prescribing. First, we are going to see about the prescription using the totality of symptom, the remedies which comes regularly in the, we can say, aspect. Here, the remedy is selected based on matching the patient's totality of symptom with the symptoms of the medicine. While drawing the totality of symptom, one must consider the weightage of other factors also, such as miasm, constitution, accessory symptom circumstances, and the probable cause if they are found prominent. A case of essential hypertension may be psoric, psychotic, or syphilitic, whose indicating symptoms may be found in the literature on the miasms also should be taken into the consideration. Until the chronic miasms are put with the latent state, chronic diseases like essential hypertension cannot be cured. After chalking out the totality of symptoms, referring to the repertories and the materia medica, which is the important for selecting the correct remedy. Argentum nitricum tops the list of the remedies for controlling the blood pressure. If it rises with anxiety and nervousness, this remedy may be indicated. Stage fright or anticipation of a stressful event can again bring on dizziness, headache, diarrhea, and a pounding pulse. People who
Sir,
need this remedy are typically warm-blooded, imaginative, impulsive, claustrophobic, and have cravings for sweets and salt. Calcarea carb. This is the remedy often helpful to people with high blood pressure who are easily tired, fatigueness, and
sir,
illness.
how many minutes more?
Just five
How many
minutes more.
slides are with you?
5 minutes more.
And the network is.
Palpitation and breathing problems that can be worse from waking up slope or stairs, and also when lying down. General chilliness with clammy hands and feet, and sweat on head during the sleep are other indicators. Glonoin is also a very
Sir, how many slides are remaining?
just
Uh,
5 minutes more, sir.
within 3 minutes, we will have to conclude
Okay,
because,
sure, sir.
okay.
So Moving on to the keynote prescribing, these are the keynote remedies, that is Adonis vernalis, Allium sativum, amyl nitrosum, palpitation of the heart and similar condition which can be readily cured by it, precordial anxiety, tumultuous action of the heart, then aurum metallicum, aurum sodium natriuminum, which is a very important remedy of hypertension with atherosclerosis and senile paresis. Baryta carb, Baryta mu. Baryta mu is indicated where the systolic pressure is high, but the diastolic pressure is too low. Cactus grandiflorus, which is with the cardiac involvement. Conium, due to the old bachelors and old maids. Crataegus, Kaliaio to Kali latifolia, Lycopodium. All these are the keynote prescribing. And the pathological prescription based upon the pathological aspect. So whenever there is a chamber hypertrophy or ventricular strain indicated in ECG, Prunus virginia mother tincture can be given. For hypertension with coronary artery disease, pituitarium can be given. Violent congestion, bursting, throbbing, headache, Rolfia is the remedy. Amyl nitrosum acts as a vasodilator. In the cases of acute MI also, it can be given like Allium sativa, passiflora, Spartium, Scoparium as acts as a diuretic and useful in the cases of renal hypertension with edema, and Passidia that works as a relaxant and as a powerful sedative. So this was all about today's session regarding the holistic homeopathic for the management of hypertension.
Thank you, Dr. NIRAV GANATRA. It's a very, very good session. You have covered almost all the part within a short time, and that itself is the beauty of your presentation. Anyway, let's just since there is lack of time, we are about to finish. Just 2 minutes remaining. We can have a short chat with Dr. NIRAV. If Dr. Boblim, what you want to say, you can ask your question, or you can communicate with Dr. NIRAV. Please unmute yourself. Yes, please unmute. Oh, yes.
Hello.
Yes, we can hear you.
Hello. On behalf of the IFPH, I would like to say a big thank you to Dr. NIRAV GANATRA for giving a very, very detailed description about the physiopathological relations with the homeopathic treatment, and I feel that it is 1 hour is not enough for him, and I hope that he will come back again to fulfill his wishes to share his knowledge to us and his experience. So I hope that our doctor here can come back again for another session to present a few cases that he has experienced before, and how do we prescribe for this very common heart diseases that we are facing each day. And also I'm very impressed with this description of the relationship between the kidney and the blood circulation and hypertension. So once again, on behalf of IPH, I thank the Dr. NIRAV. Is it Dr. NIRAV GANATRA? Again, thank you very much.
Thank you, sir.
Yes, as Dr. Boblim told that this being a forum for promoting homeopathy, it is better to have some of case presentation. Hope you can present some of your cardiac cases. Definitely, what I meant is the cases itself. 1, 2 to 3 cases can be presented in your next presentation. That will be definitely a good one. And hope with that all of you enjoy the session and really a worthwhile session. And tomorrow we will have a presentation from Dr. Amir Malik from Pakistan. Some of his clinical experience that is what he is about to talk, describe in this forum. Anyway, congratulations, Dr. NIRAV GANATRA, and those who participate in the session. With that, we come to the end of the day, 1,335. Thank you all.